So my name is Susan Poss. I've been doing nursing for very many years, and it's a profession that I have loved and would do it all over again. So one of the most meaningful things about being a nurse is being at a patient's bedside and being at their side when they're absolutely at their most vulnerable.
Being a nurse means self-sacrifice, means a call, because the work that the nurses do cannot be paid by anyone other than God Himself.
Our nurses always put their lives at risk to take care of patients, even those ones we don't know the diagnosis. Our nurses anticipate problems, so they have a vision.
When you come in as a nurse, you not only come to earn money in a hospital, but just to make a difference in a patient's life and their families.
Today is the International Nurses Day, and the theme for this year is a vision for future healthcare.
So happy International Nurses Day. Nurses form the backbone of the services that we offer. We do not take it for granted. The kind of sacrifice that you have made to bring us to where we are today as the sibling organizations.
The nurses are the hospital. If you don't have nurses, you really do not have a hospital.
There are no words to express the gratitude for what the nurses have been doing in Evercare and in the rest of the healthcare ecosystems around the world throughout these unprecedented times.
We have 4 pillars in the Evercare strategy: quality, people, operational excellence, and impact.
And so what is the best way to make an impact in nursing? To make sure that our staff are competent, they need to be multi-skilled, and then we need to be innovative in the way that we deliver healthcare. So we need to be able to take the skills and the knowledge that we've gained and find different ways of delivering the care to make sure that patients get the best outcomes.
So with this in mind, we have come up to launch the Evercare College of Health Sciences, which is now a bigger platform to enable nurses within the ecosystem and globally to transform healthcare through current medical practices.
The partnership that came about with Evercare coming on board, and now the founders with their visions, with their strategies and so forth, it has now aligned, and the boards of each of the hospitals, we came up and now we said we need to actually improve our scale, our platform, and that's how we are now having this college today, which we are launching.
My vision was to establish a college that would do things a little bit differently. We've tried to introduce different courses and different aspects of culture and relationships in our college, which started as internal training department of Nairobi Women's Hospital.
Currently, we have over 400 students in session. We are around 492. Accumulatively, over the years, we've registered over 1,100 students with us.
We have to produce not only what we need, but also for the international market in the longer term.
Our ambition then is to be the leading healthcare training institution in emerging markets, and while at that, we are transforming the quality of healthcare.
One of the things I'm proud of is that we have Evercare as a partner, who have partnered with all of us in our institutions. And this is the reason why we, as a board of the Nairobi Women's Hospital Group, which includes the college, we have had conversation and approved that we rebrand the Nairobi Women's Hospital College into Evercare College of Health Sciences.
Through training, we are improving patient safety and clinical outcomes.
My personal vision and that of the other founders is that this college will grow impact our country and beyond. And very soon, we upgrade it to a university college of health sciences.
We would like a situation where Evercare, as a group, we are actually touching the hearts and minds of everybody in the world.
As an impact-driven organization, this initiative about education and training is really core of our strategy, giving quality, safe healthcare access to everyone in the emerging market.
I really want to say a big thank you. We are celebrating today in commemoration of our founder in the nursing department called Florence Nightingale, who was born on this particular day.
Florence certainly transformed the education of nurses, and so today we bring it to this day and age to transform healthcare in our own capacity.
And even as we celebrate her birthday today, we want to celebrate the lives of each and every nurse. We want to say thank you because of the work that you do. Happy International Nurses Day.
Happy International Nurses Day.
Happy International Nurses Day.
Happy International Nurses Day, and I wish you the very best.
Happy International